Hi, my name is Kristen Skibicki. Today is April 6th, 2025. We are doing the assignment for SPCE 638-812 with Dr. Bricker, and this is regarding a staff training based on one of the forms that we developed in class. The form that I'm going to talk about today is our client onboarding and ABA service intake packet and service plan. It's a 10-page packet which would be given to clients when they first are inquiring with us about ABA services. We want to find out as much as we can to make the process as smooth as possible. So the attendees at the training would get a copy of the PowerPoint. They would get a copy of our actual intake packet. They would get a FAQ handout with just 2-page important questions to ask and things to note, and then also another handout that just gives a quick outline of how to do the intake process. So first we'll start by saying that by standardizing our approach to client intake, assessment, and planning, we improve treatment quality, caregiver satisfaction, and overall clinical outcomes. So the contents of today's training are going to be training objectives, the purpose of client onboarding. Then we're going to dive deep into the questionnaire itself, talk about practitioner matching, developing goals and behavior intervention planning, caregiver training, best practices, and then we have a little quiz, and that'll be the conclusion. The objectives for today's training are to fully understand the client intake and onboarding process. Number 2, learn how to gather and organize essential client information. Number 3, develop treatment goals and behavior plans by choosing assessment tools and collaborating with caregivers and service providers. So the purpose of onboarding clients with a very detailed intake packet is you want to gather comprehensive background information. This form is designed to find very small things that may have been overlooked by other people or practitioners. And as you're going through it, please feel free to add any other information that the caregiver provides. It's also going to help us ensure HIPAA compliance and confidentiality. And filling out this form is going to actually help build rapport with caregivers. It's going to let them tell their story about their child in a comfortable and easygoing way. And we're going to set the foundation for all that we do, from assessments and planning to maintenance. So in our questionnaire, there's 8 key categories. The first one is demographics. So that's going to be on your first page when you're filling this out and giving it to the client. You're going to put their first appointment right here on the first page, so they know, and it says please complete this packet by the time you come to your first appointment. Usually going to be about a month to 6 weeks in between, so they can see that right there, that they want to get that done soon. So the demographics includes things like the name of the person completing the form, nicknames of the child, date of birth, cell phone numbers, home addresses, pediatrician names. And then here on page 2, we have a space that the parents, we just want to ask them in easygoing language, what are the problems your child is having? Not every parent's going to say, my child doesn't know how to do discrete trial training or things like that. They're going to say, when my child doesn't get his way, he has a tantrum and throws himself on the floor. And then it's our job to figure out exactly why that's happening. And filling out this form in its entirety is going to help us do that. So that's page 2. Page 3, we still have more demographic information, marital status, mother's name, date of birth, siblings in the home, psychological history of the child, other medical information, if they've had vision testing, MRIs, any kind of information, if they had any kind of childhood illnesses. And then we're gonna keep on going down here. Number 6, it says, does your child currently experience any of the following? So we're asking the parents, do they have problems with eating? Are they socially isolated? Do they make friends easily? Do they have trouble getting to sleep, controlling their temper, bedwetting, things like that? So that brings us down to the next part, which is about previous interventions and services. So we're asking, does your child ever see other health care providers? And it's really an easy format that's easy for them to read. And of course, as you're going through it with them, they can always contact you if they have any questions, but you want to try and make sure that this is completed as best and fully as possible, so we have as much information about the child that we can get going forward. So here we're asking, this is page 5, we're asking if they've ever had ABA services before. Have they ever been hospitalized before? Were there problems with your pregnancy? Is there anything going on in the family right now that might be causing an issue? Then we're asking about previous interventions. What have other practitioners done with your child? How has it helped? How has it not helped? What grade are they in? Asking for the last report card, and so on. And then another part of that is we are asking about cultural information, which is very important. We want to know, do they have any cultural practices in the home that we should be aware about and be willing to work with. And so another important part of our goals and service delivery intake packet is practitioner matching. So we're going to talk about what specifically does their child need. This would be something that we would fill out in the office once we get to this page, the goals and service delivery plan. So the parents are going to fill out this part, which is the first 3, 4, 5, 6 pages. And then the rest, starting on page 7, is for us behind the scenes to fill out. So this part here, we're asking who's the RBT that's assigned, who's the supervisor, how many hours of therapy per week are we looking to start the child with, what practitioners match with their needs, do they need a speech language pathologist, do they need an occupational therapist, and so on. So once we gather all that information from the parents and start working on their goals, we need to develop very specific goals, as we all know that we've done before. In ABA, we are looking to develop SMART goals. So you don't want to just say that the child needs to stop screaming and having tantrums. We're going to say Johnny accepts the word no for up to 5 minutes without having a temper tantrum at least 3 out of 5 times. So you want to make it a SMART goal so it's measurable and attainable, relevant, and timely. So this is page 7, where you would list the goals and their skills. Here we go with antecedent strategies, consequence strategies, and different kinds of goals that we have for the child based on their information. The next part is the skill acquisition plan. Are we going to be teaching them with discrete trial, natural environment? How are we going to reinforce them? How are we going to collect the data? How are we going to train the caregivers? Because we need to teach them reinforcement and generalization at home and in community settings. So this is all part of the back, let's just say the back of the office information that we're going to start the child on the plan, how we're going to start it. And for some of these intake packets, I want to go over some best practices with you. Some best practices include clarifying purpose during intake. So we want to find out what's the main purpose that the family has for the child and for the therapy. We want to ensure thoroughness and accuracy. We want to protect confidentiality. We're matching practitioners thoughtfully. We're using assessment tools strategically. We're writing clear and measurable goals. We also have to know how to define behavior objectively. Plan for generalization, regularly review the data and adjust the plans, which is all going to be written down in our packet. We're going to work on collaborating with caregivers and providers and document everything clearly and specifically. So right now we're going to do a check your knowledge quiz on the intake packet, and that will take us through to the conclusion, which is that it's important to know that a thorough and consistent client or onboarding and service planning process is essential for delivering high-quality ABA services. By collecting comprehensive intake information, behavior analysts can develop individualized treatment plans that reflect each client's unique needs, history, and learning profile. Matching clients with appropriately trained staff, selecting the right assessment tools, and writing clear, measurable goals are all crucial components that set the foundation for a successful intervention. Behavior reduction plans, teaching strategies, and data collection methods must be carefully tailored to each child, ensuring that clinical decisions are based on accurate, ongoing information. So like I said earlier, you're going to be walking away with a copy of the intake packet. This is a short training highlight that just goes over most of the important parts of doing the intake packet, like the questionnaire, the practitioner matching, assessment tools, goal development, and it gives some information on where to look for that information. And then the last piece of information for today would be the FAQ page, which goes over a few questions that might come up, like how do I choose the right assessment tool? How do I make a goal measurable? And it all works together to get the onboarding information correct. Thank you so much.